In this video, I'm going to cover how to make sense of Obrien's test if positive and ease the symptoms quickly, especially if the rest of your cluster tests are negative. So, as always, don't forget to subscribe using the button below for exclusive first access to weekly content that helps you differentiate yourself from other therapists, look at the body as a whole without getting overwhelmed, to get consistently great results, reviews, referrals, and that reputation as the go-to therapist. Everything I teach you will be from my professional sport and background. Everything that I teach, everything that I implement in the clinic, I use with professional athletes also. And I'm going to show you how to make sense of the body as a whole without getting overwhelmed and bridge that gap from the low level to the high level rehab so your patients can get long lasting results. So let's get straight into it. So with your Obrien assessment, you're going to want to flex the arm to 90 degrees, elbow extended, horizontally adduct to about 10 to 15 degrees, and then the arm is maximally internally rotated and the patient resists the downward force. So just be careful. Don't you make sure when you do this test that you don't let the patient push up to you, but you just want to say to the patient, okay, hold your body here, and then you're going to push down rather than saying to the patient push up into your arm. Okay, so again, we want to get that deceleration force of the biceps to really stress that labrum rather than getting them to concentrically contract, so to speak. Okay, if this is positive, okay, so if this reproduces symptoms either in the AC or the shoulder, deep in the shoulder, might feel deep, usually they'll say retest again with the forearm supinated. And if this is negative, then that's what Obrien would comprehend that, okay, this is a positive test. Now, the problem with this test is that no kind of test in isolation is great for identifying slap tears. Certainly I've seen this with professional sport and athletes where we've had people and they've actually had positive slap tears on MRI and they've been negative. Clinically, no symptoms whatsoever, and vice versa. Okay, so again, you want to be very, very careful. Just because they have positive symptoms doesn't necessarily mean that they need surgery, and there's a lot we can do. So again, with the sensitivity, there's a wide range of variability here. Okay, so we just need to be very, very careful with interpreting these results. But that's good news for us, because what we want to do is we want to be able to go, right, what can we influence? And Len Funk at shoulderdoc.co.uk, shoulder surgeon I use a lot, very, very good surgeon. He says here, with this test position, when he looks at this in the theatre, it displaces the biceps tendon immediately inferiorly and then pull tension on the labrum basically. So what we can do and what we can use our knowledge to go is, okay, what can I do to influence that? So you could see when we internally rotate, we want the lengthening of the biceps. Okay, so if that biceps can't lengthen, especially with that pronation, you can see the long-headed biceps here as well. Okay, and the short head, you could see with this muscle that if this isn't lengthening, okay, so again, this isn't a great angle here. Okay, but if this isn't able to lengthen, then it's just going to pull on the labrum basically. So essentially we want it to lengthen, obviously in extension, because the test will be extended, but this is the key bit for me is this internal rotation, okay, or pronation of the forearm first and foremost. We want that bicep to be able to go through its full range of motion, and if we can do that, then hopefully we can influence and desensitize these tissues and get this test to be negative. And then, as always, we want to make sure that everything does its job, because it's not just about getting a test negative, it's about getting the person back to the real world. And it's this test may be useful if this is the position that the patient is struggling with their symptoms. So if they have to reach across their body and they're doing something, like reaching for something, then usually you're probably going to have some internal rotation of the shoulder there as well. Okay, so the ultimate goal is to get them back to this. This is usually clinically what we see. It's not always going to be accurate, this, in terms of the percentages. These percentages are just for learning purposes. But what we might say here in this position is, okay, the labrum or the shoulder joint's getting a bit irritated because something else can't do its job. So for example, if that long-headed bicep and even the bicep in general can't lengthen, especially in the transverse plane, is that creating that excessive tension on the superior labrum. Okay, so our approach is, let's get everything doing its job. Let's still respect the pathology if there is pathology or the symptoms, but let's spend 80% of our time and attention getting everything to do its job. And as you can see, real world tasks, a lot of this intention starts at the fingertips. So even with the gear stick here, you can see there's going to be that forearm pronation. We're going to want to lengthen the bicep in the transverse plane, even if it's shortened in the sagittal plane. Okay, so that's very important to understand. And then that's the key thing to understand here, especially from my experience in professional sport, is that just because somebody's pain free in the clinic or the treatment room does not necessarily mean they're safe to go back to the real world. Okay, so again, you have to bridge that gap from low level to high level rehab to ultimately get that patient to move, as Louis Gifford says, with thoughtless, fearless movement. So again, a lot of our exercises at the start, a lot of therapists, they can be just using conscious cues. Okay, I want you to recruit your traps, your lower traps. I want you to isolate this, isolate that. Real life, it doesn't work like that. Okay, so in real life, we reach with our fingertips. Usually our intent is with our hand. Our fingertips lead the way, and the shoulder joint reacts to whatever else the hand and the elbow is doing. So we need to get that into our rehab, where we're moving using bottom-up approaches, where the shoulder muscles, the cuff, the traps, the serratus, they're all working outside a higher center control, because that's ultimately where confidence and self-belief is built up. Okay, so if that makes sense so far, what I want you to do is just let me know that I'm explaining this well to you. Pop a yes in the comments, followed by your biggest takeaways, so that we can retain this information, we can apply it. So in order to influence the SLAP lesion, what we're going to do, if there is a positive and we think that, okay, we're not quite sure if it is or not, what we're going to do is we're going to influence the ability of the long-headed biceps to lengthen. And as Len Funk notes here, if we can get that long-headed biceps and just bicep in general to lengthen, then hopefully we'll influence that capsule, and ultimately then we'll take away that pain experience very, very quickly, from my experience. Okay, so that's going to be the approach. But not only that, then you could also see with the nearest test that when we do that, then the second part of the test obviously is that we want to transfer load. Okay, so again, with that internal rotation, long-headed biceps wants to lengthen, but also we want to be able to tolerate a lot of load through the biarticular muscles. Okay, so they transfer energy, and one of those is the long-headed triceps. Okay, so again, with that triceps, okay, in this position, okay, if we modify this to O'Brien's test, if we bring that around, that's going to need to lengthen a little bit. But as I press down, that's also going to have to stabilize the elbow joint, and it's going to have to transfer force through the body as well. So we're going to want to make sure our approach is to get some length through the long-headed biceps, get some load tolerance through triceps as well, and train these muscles to work under isometric conditions, because when we go and we're doing a lot of movements, the elbow has to work isometrically. Okay, so if that makes sense, pop a yes in the comments. And special mention to Muscle Emotion. Thank you for a great app that allows me to make sense of what's not doing its job, look at other parts of the body as well. And if I ever have a tricky case, I always go into Muscle Emotion. I'll look at the movements, I'll look at some of their videos and go, right, what else needs to do its job? And if you want to check that out, they've kindly given us a voucher code, so PSP20 will get you 20% discount. I personally like the strength training app. That's the app I use the most, but they've some great apps there. Okay, so with that said, let's get into it. So we're going to spend 80% of our time making sure that the long head of biceps in particular as well, that can go through full range of motion. And then we want to tolerate load through the triceps under isometric conditions. Okay, so again, whether you do your hands-on tree or whatever you do it, okay, I teach a certain way in the mentorship. We've got all the different stuff here. This is our module 3, which is one of our modules for the lower limb. You use whatever you want to desensitize, but then certainly 2 tissues that I'm going to want to be particularly interested in is doing some soft tissue work to the biceps and to the triceps, okay, for these slap tears. And again, they clear up very, very quickly usually with that. The next thing we want to do is we want to get some length through that triceps, okay, through the biceps. So again, with these exercises here, okay, all Shane's doing here is you can see that internal rotation, and he's putting his hand pressure towards the index finger and thumb. So as he shifts that, that's going to create that reaction. and then we're going to get that lengthening in the transverse plane. You can see that biceps is lengthening here. Okay, so again, the end, what you'll notice is a lot of people, if they can't lengthen that biceps, that you'll get a massive anterior translation of the humeral head. Okay, so that's going to be one exercise that we're going to be very interested in. The next exercise then is, okay, we've got some length through, now we need to show the nervous system it's safe to tolerate load. So I'm going to create some perturbations in the transverse plane, and all I'm going to do is I'm going to challenge my base of support, put my belly button over my toes so that the nervous system has no choice but to tolerate load going up through the bicep into that labrum. I want the cuff working as well, and then I'm just creating that perturbation there. So I'm just shifting the way from my little finger to my thumb, and what that's doing then basically is that's creating that top down, bottom up transition, where basically I don't have time to think about it. My cuff is working outside the higher center control, my biceps taking a lot of load, and I'm starting to work that pronation, supination function of the biceps as well. And then the key thing is we want to, as we transition to thoughtless fearless movement, is we want to be able to really rotate and lengthen that tricep. So you can see the thumb here, it's twisting. That's the key thing here, is we get that lengthening through the biceps. So again, we're decelerating through the biceps to help those tissues lengthen. So again, the thing here, if we go back to Len Funk, okay, we want to make sure that biceps can lengthen. We want to make sure it can tolerate load, it can decelerate or body weight. And again, if we can't, if there's any protective tone or it can't go through full range of motion, is it going to put more pressure on that labrum? Okay, so that's my approach with these injuries. If your clusters are negative and you're pretty sure that they may not have a labral tear, but they have some discomfort with that test, then this is the approach we would do. Okay, so that's one part of it. Then the other bit that we saw is we also, with the test, is we want to be able to tolerate load, and we want that load to transfer through the tricep as well. Okay, so again, that deltoid, when you're pushing up, your deltoid's going to be working a little bit as well. Your long-headed tricep's going to have to tolerate load. Okay, so again, with that, we want to make sure that we can lengthen the long-headed triceps. Same concept with the triceps. I'm basically going to put the person, if I get it here, I'm going to put the person in a position where they've got no choice but to tolerate load. Okay, and then the final progression is we are going to just get that low tolerance through long-headed tricep in these positions. And again, I can start to rotate my body and I can come into the positions of the Obrien's test as well. So again, we're starting to increase that movement, that speed of movement, which is so important to get back to thoughtless fearless movement. And as always, every time you do one exercise, recheck your KPIs, make sure the nervous system is happy to tolerate that load and you're not seeing a regression of either your flexion, your abduction, your Aples, whatever test you're using. Now, I've only showed you a couple of exercises here today. The key thing that you need to understand is that's A, B. As I said, to athletes, outstretched hand, wrestle, contact, that's probably F. We need to bridge the gap from A to B to C to D to E to get to F. Okay, and again, we cannot skip the steps, and that's where we start to build that person up through a graded exposure program, and that's where we need the full A pillars of the go-to therapist. We cannot just rely on one hands-on treatment technique or one exercise. You need to be able to clinically reason. You need to be able to get the same results with your rehab exercises that your hands can do short-term, get long-lasting results, bridge the gap from low level to high level, and then continue to build tension, resilience, and strength on the back of that. If you want to know more how to fill that gap, head over to www.thegotophysiotherapy.com/free, and you can have 14 days access to my free shoulder return to play course, where I'll show you exactly how to build this out and to bridge the gap. As always, thank you for your time. If you found this useful, leave me a comment below, and then I'll make sure to know that you're getting value out of this, and then I will continue to make more and more content like this if you find it useful.